Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hello, and welcome back to another episode of What Did the Patient Say with our patient interview series. My name is Dr. Peterson, and today we'll be talking with my patient Madison about her experience going through treatment at CFNC for dysautonomia. Thank you for joining us today, Madison.
Yeah, thanks for having me.
Of course. So to start off, can you tell us a little bit about what were the symptoms that you were dealing with initially, and when did these symptoms start?
Yeah, my symptoms were fatigue, sometimes very debilitating fatigue, sleep problems that were falling asleep, staying asleep, waking up in the morning, stomach issues, just digestive problems of all kinds with nausea and sometimes just random episodes of vomiting. I had pain and tightness in my trap muscles in my neck. I had headaches for a while, lightheadedness, vertigo, and dizziness that came and went. My heart rate spiked up 40 beats per minute when I stood up from a lying position when I measured it once. I had pretty bad brain fog and get air hunger and exercise intolerance, orthostatic intolerance, shakiness and weakness, occasional tingling in my fingers and toes, temperature dysregulation and hot and cold intolerances. I had ear ringing and pressure changes in my ears, and then blood pooling mostly in my legs and my feet with really bad feet pain, joint pain mostly in my knees, and and they didn't all happen all at once, and they just fluctuated. Sometimes a couple of them would be really bad for a couple months, or they just seem to go away. But I think some of them started as early as age 7, and probably by 12 or 13, the rest of them had developed. And again, just kind of coming and going, not all at once usually. And yeah, I'm not really sure what brought them on in the first place. Yeah.
Okay. And can you share a little bit more? I mean, that was quite the list of symptoms, but can you share a little bit more about how that was just kind of affecting your day-to-day life prior to coming here?
Yeah, for sure. I mean, I think I kind of blanketed a lot of them under just fatigue and didn't kind of know the nuances of them. And so I'd say, just was really exhausted during the day and had just crashes in the afternoon, and I'd sometimes lay on my couch for like 4 hours in the evening and felt like I couldn't move from that fatigue. And just not getting good sleep at night and not knowing what maybe will digest well or what won't. It just every day was very unpredictable, and it seemed like I couldn't figure out if there was a rhyme or reason to it. And so every decision I made was just kind of based off of how I was feeling, and which was usually quite poor. It definitely impacted like my social life and just the amount of things I could do and energy I could exert, even back in middle school with sports and going on events and things, I would opt out of because I didn't know if I would make it through something. But more recently is when they just kind of got at their worst towards the end of last year, beginning of this year, and my job came to an end at the new year, and then I didn't think that I could sustain another job at the time. So I moved back in with my parents, and couldn't imagine working earlier, just within that first month of the year. So that's just when my symptoms were at their worst, and I was just not doing much during the day, just living at home and resting a lot because I just didn't have energy to do really anything.
Gotcha. Thank you for sharing. So what type of care did you receive before you came to CFNC?
I didn't receive much of anything specific, and I think that was just because I wasn't receiving a diagnosis from any doctors or specialists I had seen, and so I never even got to the treatment side of things, I guess. I tried some medications over the years. They didn't help much in the long run. I reset my circadian rhythm through my sleep specialist, which helped with a few things, not everything. And just did a lot of extensive testing, saw a lot of specialists. I will spare you the gory details. But just lots of testing and lots of specialists. I did, apart from a positive ANA, everything else came back normal in labs and blood work. And even with the ANA, the rheumatologist I saw couldn't pinpoint that. And so I was told it was probably just something that was dormant and would probably come up later in life. So I had that to look forward to. And then I did see a neurologist, I think, in November of last year, 2023. And I had just shortly before then heard of dysautonomia. I thought maybe that's what I had. So I brought that to him, and he said it sounded like that's probably what I did have. But he told me there wasn't much hope for treatment for me. So other than just like adding electrolytes to my water and wearing compression socks. So that was sad. But I think that is mostly on that side of things.
Okay. And how did you end up finding us?
So I was in the middle of looking into kind of a health retreat thing. A lady in my church wanted to raise money for me to go. And so my mom was looking into that, actually, and that obviously totally separate thing. And then I was deciding if I wanted to do that. I was pretty hesitant to just try anything new at that point. But so I was in the middle of thinking through that, and my mom saw one of your podcast videos on YouTube, I think just through the algorithm, and it was of the two sisters and founders talking about the types of dysautonomia, and she watched it just to learn more since we had recently heard of it and thought that was probably what I had. And she just really loved everything about it, and how they talked about how they're able to figure out the parts of the brain that aren't operating right, and treat it. And so that was pretty hopeful compared to what the neurologist I had just seen told me. So yeah, we pretty much found you that way. And it was interesting because I was like right away, I was like, yeah, that's where I want to go, versus the other thing I was kind of hesitant about. But I had this weird sense that it was going to be what would help. And just, I mean, you guys, we looked at your website and you said you could pretty much figure out and treat to the best of your ability all these different things. And we hadn't seen that elsewhere, hadn't looked a ton. But yeah, we were pretty sold from the get-go. And I think it wasn't long after that we scheduled my appointment for my intensive week, and just a couple of months later it came down. So yeah.
Yeah, that's awesome. So Madison came to us all the way from the beautiful state of Montana. And as she just stated, she did come in for an intensive week. And so she came in for the exam on that Monday morning, and then we hit the ground running with treatment. So a lot of the things that we did with Madison were various forms of what we call orthostatic retraining, basically retraining the body's or brain's response to changes in the demand of gravity. We also did various forms of vestibular rehabilitation and eye movement exercises. If you actually look over Madison's right shoulder, you will see the dots that we often use for that, and that she's continuing to use now that she is at home. We also did other forms of multimodal sensory stimulation using things like vibration on her abdomen and spine, and doing some other strengthening exercises, as well as beamer and red light throughout that week. So Madison, tell us a little bit more about what your experience was like as a patient here at CFNC.
Well, I'm glad you said all that, because I could not repeat all the different things we did. You explained it to me while I was there, but my mind was blown and fried by the end of the week. So I glad you covered that part. But yeah, it was amazing. I loved it. Just office and staff and environment was very welcoming. And the care was just very intentional and caring. You listened really well and asked questions without like rushing me through my answers that took me a while to come up with sometimes. So that was just really different in my experience and was pretty special. So that was cool, but yeah, even just all of it was very unique compared to what I've experienced in the past, especially just with the testing and kind of figuring out through watching a lot of my eye movement tests. Yeah, the correlation that had to my symptoms and my fatigue, and I would never have guessed or known that that was a thing. But it made perfect sense when you explained it. Yeah, I don't know if that answers your question. That's all I can think of at the moment.
That's a perfect answer. One thing you said, some things were unique in your experience to your experience here at CFNC. One thing that was unique in my experience was Madison and her mother completely bought out our stock of merch. It seemed like every day they were coming in and buying a new sweatshirt or buying a new t-shirt. And so I hope that those have served you well since you have taken all of that back home.
Yeah, that's been super fun. It was a very small way to give back, because I know that's part of your funding for other patients. So that was like our kind of small way to give back. And we love it all. Give it to the family and the friends, and they love it. So
amazing. Well, we definitely appreciate the support, and I'm glad that they're getting used well by you guys over in Montana as well.
Yeah.
Wonderful. So compared to when you first came to see us then, how would you say you're feeling today?
Well, by the end of the week when I was there, I think I had rated it as I felt 60% better overall, which is huge. Now, I think maybe 75% better. Just, yeah, increasing to continuing to improve for sure. Especially this last month, I feel like I've made some good strides, and we tweaked some things. So that's been fun just to see the improvement, even at the end of my week there. Even like, I think my next to last day, I even noticed just in the hotel when I got up out of bed, like I could feel my heart racing a little bit, but it came back down and I didn't feel lightheadedness. So that is cool. And I've noticed even like my ears don't ring as much, which never seemed super significant to me compared to the other major issues I was having. But yeah, I have just more consistent energy through the day. If I do get a little lightheaded or my heart rate seems to jump a little bit, it's very minimal compared to what it was before. I don't feel like I have to like pause and close my eyes and breathe through it. I kind of just maybe slowly move through the next thing, but it's really improved a lot. Yeah, I mean, as just like a contrast from before and now, I'm looking for a job, getting ready to move out. I'm going to attempt college, which is something I never thought I'd do. And I can't leave out the detail that it is hopefully to pursue functional neurology education myself. So that is super exciting. Definitely a life I didn't see coming or really had before. So very, very fun and exciting and terrifying all at once. But yeah, right now I'm feeling pretty great. Even my mom commented yesterday, I can't remember what it was, but just had made a comment that she was impressed with how well I was doing. And she's been with me through it all. All the doctor's appointments in the beginning came with me to North Carolina. So if she says it, it's true. Leave it at that.
There we go. That's amazing. I'm so happy to hear all that. When Madison told me that she was feeling up to even pursuing additional education, which is something that, given her symptoms and what she's been dealing with really her whole life, that alone I was so happy to hear. But then to take it a notch further and say that she was actually interested in pursuing a education so that she herself could become a functional neurologist. I mean, there's no bigger form of, I don't want to say flattery, but it's just to have had that much of an impact on your life. It just makes me so happy. So that's amazing. I was going to ask you to bring that up, so I'm glad that you did that on your own. That's great. Then I guess the one last thing that I have to ask you is if you had one piece of advice that you could give to anybody who found themselves in your same position before you came here to CFNC, what would that advice be?
The thing I want to say is to go to CFNC. Duh. That will do more than you think. Don't give up, because if you've exhausted all the options and had a very thorough process of elimination like I did with all the testing and everything, just in the more conventional side of things, it doesn't mean there's not an answer or a treatment out there. And obviously if you're watching this, then this is your answer. This is your sign. It's worth every penny. And if you're not local, it's an amazing trip too. North Carolina is amazing. So yeah, I guess that's all that comes to mind, but yeah.
That's wonderful advice and words of wisdom. Thank you for the plug.
for sure.
Well, thank you so much for joining us today, Madison. For anyone listening, if you have any questions, please leave a comment or feel free to reach out to us. Also, please visit our website at carolinafnc.com for additional information on our treatment programs. Thank you and have a nice day.